Welcome to Good Samaritan Regional Medical Center's joint orientation class. My name is Alan. I'm one of the occupational therapists here at the hospital, one of the rehab disciplines that will be seeing you while you are here. Thank you for taking the time to look through this information. We hope that it is helpful for you as you continue on this process. I would really love to be able to meet you in person for this class, but due to the COVID restrictions, this is the method we have to use. This presentation includes information about what you can do to get ready for your surgery, specifically the rehabilitation process that happens with occupational therapy in this this video, and then physical therapy will have a different video for you to view. Goals for this presentation would include ultimately trying to prepare you for the surgery best we can. Provide information about the hospital process, generally what happens while you're here. Ideally, most of you are not too familiar with the hospital. I hope you've been able to stay away from this place. But this is a good reason to come to the hospital. And remember that while you're going through this, you're coming here to get a new joint, whether that's a hip or a knee replacement, and be able to live a better quality of life and have less pain. We want to address any concerns that you have, not create them, and ultimately all of this information ideally will help improve your outcomes and your results as you go through this process. Occupational therapy, why would you see me or somebody like me while you're here? We are looking at all those everyday things you do. We call them activities of daily living, or ADL, and those include things like dressing, bathing, toileting, transfers, and home management tasks. Also, equipment is a big part of facilitating activities of daily living and independence and safety. And so we'll talk about some of those things. Endurance and energy, this is a tiring process. So your body's going through a lot. Expect to be tired. And so you do need to get rest as well as activity. And then also you want to make sure your nutrition is good so you are able to heal properly and as fast as you possibly can. There'll be another video that will talk about physical therapy, and you'll be able to access that. It is important that you think about doing as much for yourself as you can, and there's a couple stipulations with that, and one is that you are safe doing it, and another is that you don't wear yourself out and get too tired. All right. Precautions and restrictions. There are many similarities to the general process of replacing a hip or a knee joint, and there are some distinct differences as well, though. For everybody, no falls allowed. So you might ask, well, why do we even need to hear about that? Of course, we're going to be careful. Well, it is different after you've had your surgery, even though it's been repaired. There's this healing process. And so you just need to be ready that, your leg, you may find your leg is having some different difficulties than it did before you had surgery. So you just need to be prepared that it may not want to hold you up, for example, as well. It just may not move as quickly. It may be a little less coordinated than before. So just be really aware, what am I doing? Where am I going? Just do everything you can to reduce the risk of your falling, and we'll talk about some things with regard to that. Weight bearing is tolerated. This is a similarity for both hip and knee replacement. Vast majority of the time, 99+% of the time, the doctor is going to tell you that you can weight bear is tolerated. That means put as much weight through your leg as you safely can. Do not expect it to hold you up all the way right after surgery. It will do some weight bearing, but it's going to be uncomfortable, and so you just want to be aware of that. It will get better over time, however. So those are most of the common things. I just put up the difference. Total hip replacement has some precautions, whereas total knee replacement does not. It's just the way those two joints are designed. They're a different type of joint. So again, with the hip, there are some precautions to decrease the risk of a dislocation. So if you're having the knee replacement, you don't need to necessarily listen to the next few minutes of what I'm talking about. It's just for those people having a hip replacement. So the precautions you have are based on different surgical approaches that the doctor will take. And you should have handouts from your physician specifically that go over these precautions, but I'm going to talk about them here as well. So these precautions could be from 6 to 8 weeks or as many as 12 weeks. Your surgeon will let you know when you can relax on some of these. Dr. Stanley, he uses what's called a posterior approach, and it's just toward the back of your hip is where he makes the surgical entry. And based on that, you have these precautions. Don't bend past 90 degrees. Don't cross your legs, and don't turn your foot inward. This is just the approach that Dr. Stanley has maybe learned how to do it this way, and this is the approach he uses. No one approach is necessarily better than the other. It's just what they use. So look at these precautions, think about them. We'll ask you these while you're here. We really like you to have them down where you can just recite them for us. And then, of course, we'll specifically show you what that means as you go through your daily routines and what you need to be careful about. We'll do all of that while you're here. If you have Dr. Evans, he uses more of what's called an anterior lateral approach. That's from the side. Again, this is just the technique he likes to use. And so you again have no bending past 90 degrees. There's no turning your leg outward or bringing your leg out to the side on its own. You need help to do that. And then don't cross your legs. So again, we'll show you how these relate to your daily activities while you're here. Just look over these periodically before you come in so you can have an idea when we ask you what are your precautions. But we'll explain them further while you're here. And then Dr. Tedesco, he has an additional different approach. And again, it's not necessarily, better or worse than the others. It's just what he uses. And so with this precaution, there's no bringing the leg, turning the leg out and bringing it out to the side at the same time, and no crossing the legs. You notice you don't see a precaution about bending 90 degrees at the hip. So that is a difficult thing for most people to do, regardless of what your precautions are, whether it's a formal limitation or not. So again, all of these approaches, you can replay your doctor specific to look at what I said. We'll go over these, but each approach, it's just the way your doctor does the surgery, and they will all work out fine for you. Preparing your home environment, this is really critical. A lot of what we're doing is teaching you, of course, things to do, not do, but your home environment is a big part of that safety and independence equation as well. Do you have a single or multi-level house? Can you stay on one level? If you can, you will find that to be probably more beneficial, not as tiring. If it doesn't take a lot for you to do that, to set up the downstairs for you. Avoiding stairs certainly can be safer. However, we have people that have a bathroom only upstairs. They may have stairs to get into their home, so you will all trial most likely at least a few steps And if it's stairs and that's something you need to do to go home, then we'll go over that and incorporate that into your plan, and physical therapy will take care of that piece for you. So it's just things to think about. Open clear pathways, remove throw rugs, clutter, be careful with pets. You just want to, again, we're trying to reduce the risk of a fall. So just do those things that are just going to make it safe for you and your walker to go everywhere in the house. You're going to need to take a walker everywhere you go. You'd need that walker to help you because of your leg needed some assistance with that weight-bearing issue. So it needs to go into the bathroom and up to the shower and all those places. So just clear things up. Seats are real vital. This is important for all of you. When you're seated, when you think about how high is the surface, do I have arm support? Is it comfortable? Can I sit here for a while? Because we ideally want you to be out of bed more than in bed. Now, if you have that knee replacement, you're going to want to make sure that you also can support your leg on something while you're seated for longer periods of time. This could be an ottoman, a recliner where you can lift the legs up, but if you have that knee replacement, you want to keep that leg elevated and that knee straight. Do not put anything under your knee. If you have a knee replacement, you can use maybe a blue wedge that you got from the hospital to elevate it, or put something under your heel, but not under your knee. If you have a hip replacement, you can elevate your leg. It's just not as critical as the knee. The knee is further down the line of the leg, so to speak, so the elevation is much more critical with the knee replacement. Here's just a picture in a home of a room. You'll notice there's a pillow on the chair, so you want to increase the height of things when you sit. Good idea for everybody. Very critical if you have that hip replacement. If you have the precaution of a bending limitation, you need to make sure that your hips are a little higher than your knees when you sit. But again, that idea of higher surfaces is good for all of you. Just very important for hip replacement. There's a pet there, so again, be cautious of those folks. You won't be using a cane, like it shows in this picture. You will have a walker. So you need that space to get around. Standard walker is about 2 feet wide. And then I'm always reminded of this picture with the night light. You can see that over by the stairs. When you're at home, if you have to get up at night, leave a light on, use a night light in the bathroom, wherever it might be. Give yourself a good fighting chance to get around, and again, reduce the risk of that fall potential. The specific spot in the house is going to be the bathroom and the toilet. It is the lowest seat in the house at about 15 to 16 inches off the floor. So if you are having a hip replacement, that is too low to sit on. A standard toilet at that height is too low for the vast majority of people. Unless you're under 5 feet, well under 5 feet, you're likely going to need to get a raised toilet seat. If you have a knee replacement, do you need a raised toilet seat? You don't have any formal precaution for that, but it may be something you need. If you're having a knee replacement and it's not easy to get off your toilet now, I would get a raised toilet seat. They make different kinds of seats. We're going to look at a slide here. This is what I call the ultimate bathroom setup. Has practically every known piece of device here. So if you look at that toilet, there's a riser, a raised toilet seat on it. And there's also some arms directly around it. That's called a toilet safety frame. If you have a sink or counter beside your toilet, that can often work just as well. However, if you don't have anything beside your toilet, then I would strongly consider a toilet safety frame. Or they also make raised toilet seats that have arms attached to them. There's a grab bar in that picture by the toilet. That's not a bad idea. But again, as long as you perhaps have a grab bar or that counter, or maybe the arms around or on the toilet seat. Something to push up off with your hands is what we ideally want there. The other item that is in that bathroom is going to be the tub shower or walk-in shower. So you definitely are going to want somebody to help you do this when you get home. We will go over this while you're here based on your situation, whether that's a walk-in or tub, and we'll specify that training again for what you have to deal with, and we'll likely have you demonstrate that as best we can per your home. But again, definitely want to have somebody there for that. If you have a tub shower, if that is your only option to bathe, I recommend you remove the shower doors so that you have the full width of the tub to get into. When there are shower doors on a tub, the space becomes very tight, maybe about, 25 to 30 inches to get in. And that's just not enough room if you've had a knee or hip replacement. And you don't want to hold on to any kind of handle on shower doors. That's not going to be secure enough. So I recommend shower doors come off with a tub. If you have a walk-in shower and you have doors, that can often work just fine. You all will want a non-slip surface. Definitely consider that. A mat in there or a textured surface. You don't want to be sliding around. A handheld shower and grab bars are also very helpful. Not all showers are accepting of grab bars. They have to be ideally placed into a stud, and sometimes that is not, again, possible because of the type of shower or tub you have. So initially, to get in and out, a walker is going to be the thing that helps you the most because you can bear your weight through your walker. You're going to find your surgery leg is not necessarily real happy holding the weight of your body. So we'll show you how to use the walker with to get into the shower or the tub. And then a tub seat or a shower seat. I think it's always great to have an option, but I have many people that go home. While they're here, they demonstrate that they stand very well. They have good balance and endurance, and standing for them can be fine. We'll have a good sense of that while you're here, but a shower seat is something that I also do recommend to some people. So it's not a difficult thing to get. It could be purchased or obtained after your surgery if it looks like you need it. So I know there's a lot of information I went over with that. Again, I would highlight if you have a tub shower and you have doors, I would take those off. If you have a walk-in shower, it likely will be okay just the way it is. And again, we'll go over that specifically when you're here. Equipment, so considerations further, there's that ultimate bathroom here. And so this is what's called, in this tub, it has a tub bench versus a seat. A seat, the whole thing fits in the tub. Most people do not need a bench like it shows in this picture. We typically can teach them how to step into and out of the tub with the walker, but this is one item that can be used. You sit on the edge of it and swing your legs over. I would not go out and buy this device unless you've really had a lot of trouble stepping into the tub, but I would just still wait. We'll go over this, we'll figure it out. It's something you can get when you, if you need it, when you leave the hospital. Your family could obtain it for you. You notice there's grab bars in here, which are great, but I touched on that grab bars are not necessarily going to help you get in and out in the beginning. So it's not a mandatory thing that be placed in there. I think it can work out with the walker just fine. And then there's the handheld shower that you can see that it is very helpful if you're seated or even while you're standing. Getting dressed. We're going to go over that. Yes, you're going to get dressed at home. You're going to get up, you're going to get dressed. Discourage you from staying in a bathrobe or a house coat or something like that. You want to get back to normal routines. So I would keep the dressing fairly simple. Clothes should be maybe a little looser, not real tight and binding. You want to just have plenty of freedom of movement in there for your hip or your knee. And shorts, if you're inside most of the time, shorts can be good if you have a knee replacement. So if it is difficult, we'll take a look at getting dressed. And if it's difficult for you to reach your feet, to put on socks and pants and underwear, we just will practice at it. There are some devices that can help. If you have a knee replacement, I'm always hopeful people can get dressed in kind of a normal way without having to use equipment. But if you need it, we'll show you. Now with the hip replacement, because again, with that hip replacement, you're going to have some precautions, some limitations about how far you can reach forward formally, or your hip is just going to be reluctant to do that motion, to bend forward. So there's dressing equipment like a reacher, a sock aid, a long-handled shoehorn, or sponge that can facilitate you being able to do dressing and bathing for yourself. So we have equipment here at the hospital to practice with, but we don't issue any equipment. So you don't need to bring your equipment in. We will show you with ours, and it would be close enough. But I would, if you're having a hip replacement, I would strongly recommend you definitely consider a reacher and a sock aid, a back brush or a sponge for when you bathe, and depending on your footwear, your shoes, maybe a long shoehorn. It just depends on if your shoes are tight, then the long shoehorn can really help. They make what's called a hip kit that is sold online. You can get these items individually online, or what's in this thing called a hip kit. You can Google all this equipment. Most pharmacies have a reacher or a grabber. I have not found a sock aid very often. I'm pretty sure that Rice's Pharmacy here in Corvallis has that device, but that can be obtained online. If you're getting a sock aid, the hard plastic style I think is the best one to use. If you don't use equipment, if you have that total hip replacement and you do not have equipment, you are going to have somebody help you get dressed. It's not a safe way to do that and maintain those hip precautions. So again, I want you to do as much as you can for yourself as long as you're safe. And the equipment allows you to get dressed on your own, and that is what I recommend you do. We'll trial the equipment. At least I ask you to do that while you're here to see how it works. And it just takes a little time to get used to it, but it works out well. After surgery, typical normal daily activities: get up, get dressed, sit at the table for meals, no breakfast, lunch, or dinner in bed, okay? Move around regularly. This is, every hour or two, at least every 2 hours, get up and move a little bit. You just want to keep that knee or that hip limber. You want to exercise it. Everything you do with that leg is exercise. Your activities of daily living, your mobility, every opportunity of doing something is a chance to get better at it, and to let that hip or that knee know that these are typical things that you expect it to do. Okay? When you're up, consider what else you may need to do. Do you need water? Do you need to go to the bathroom? Be efficient about what you do. We'd like you to get up, but just think about what you might need to do while you're up. As you feel better over time, and you will, and the pain will go down, you need to just be adding more in and doing more. So just increase that activity level as you're feeling better. You can stay up longer. You'll notice you can walk farther. You can stand on your feet. You can start doing more functional tasks. You will be able, ideally, to get rid of that walker. So you just want to be doing all of these activities. And again, the goal of all of this for me, simplistically, is that you can do as much for yourself as long as you're safe and you're not getting too tired. So that's what we're going to work on while you're here. This is my last slide. I hope this has been helpful and informative. And so we really look forward to seeing you here again. I wish I could have met you before the surgery, but we look forward to meeting you and going through this process with you, and it will all work out well.